Health experts continue to warn older adults and those with complicated health conditions to do everything possible to stay well. And transplant patients, they are also at risk. Medical reporter Liz Bonus explains why.
Uncle Greg, how are you?
When we first met Greg Brunner more than a year ago, he had just been given the gift of life. His niece, Cindy Kuethe, was his living kidney donor.
What would you like to say to the sweet girl that saved your life?
I love you, Cindy. Thanks so much. You're now my favorite niece.
Since then, however, like many others who've had transplant surgery, he's been on a careful medical regime to stay well. But University of Cincinnati transplant care specialist Dr. Amit Govil told me, when it comes to the coronavirus,
because our patients are the highest risk population that are at risk for acquiring this infection.
Right now, Dr. Govil says, for those who've had organ transplants,
the frequency of these organs getting into trouble is still very low. We do not know as of now if transplant patients do any worse than general population when it comes to COVID-19.
For those waiting for an organ donor, Dr. Govil says in this coronavirus crisis, there's something they should know. They can't use the organs of those who die from this virus. But to be sure no healthy organs are missed.
More and more centers across the country are now testing the deceased donors before they donate the organs if they have COVID-19.
For now, if you've had transplant surgery, Dr. Govil says take all the same precautions you did to prevent infection right after surgery. As you can see, when we first met up with Greg at that time, we kept our distance far away, but kept our continued prayers as close as ever.
The whole Sunday school class was texting me yesterday. They're like, the kidney's peeing.
I'm medical reporter Liz Bonus reporting.